An update now on a story that WGN Investigates has been following since the pandemic began, the economic cost of the COVID-19 crisis.
WGN Investigates' Ben Bradley has a look at some of the unusual ways the money is being spent.
The meter is still running on Illinois' COVID costs. Right now, it's at more than $500 million. The CARES Act means the feds will reimburse the states for costs directly related to the battle against COVID-19, but there's still your tax dollars.
This is a public health crisis, but it is accompanied by massive economic disruption that's unprecedented in modern history.
Governor Pritzker said that more than 2 months ago, and little has changed. We may have bent the COVID curve, but the bills keep on piling up. According to records made public by the Comptroller's Office, the state's COVID costs now exceed $531 million. Do we have any sense of how much of that money may be reimbursed?
Every penny of what you see on the COVID-19 portal is an allowable expense.
Allowable means reimbursable by the feds. But where is that money going? Amid the tsunami of spending, we've told you about the $1.7 million spent for 2 charter flights with masks and gloves from China. The $460,000 spent on 800 iPhones for use at McCormick Place. But there's more, a lot more, in fact. WGN Investigates found one of the largest expenses at more than $104 million went to reimburse the Chicago Board of Education and other schools and nonprofits that provided meals during the pandemic. $395,000 was paid to GMMB Inc., a Democratic consulting firm that did paid campaign work for Governor Pritzker. The Washington, D.C. based company was hired by the Illinois Emergency Management Agency to buy ad time for COVID-19 public service announcements like this one. The PSA was created by an ad firm at no charge. The governor's emergency powers allow him to spend taxpayer money without the usual levels of oversight. But some state Republican leaders say with so many checks being cut, there needs to be more checks and balances. How much oversight has the legislature been able to perform?
We've had virtually no oversight. We've been asking for months for the governor's office to share data, to share the data behind these data-driven decisions that they've been making.
And I would rather err on the side of caution than to have people dying in the streets. It was money we had to spend. We didn't really have a choice.
Other notable expenses include more than $8 million for medical staffing at Cook County Jail, where a total of 762 detainees have tested positive for the virus since the outbreak began, and more than $11 million to staff the alternate care facility at McCormick Place. Officials converted the convention center into a field hospital in early April to prepare for the possibility of a surge of coronavirus patients.
5 short days ago, this was an empty convention hall.
Only 36 patients were ever treated there. While the McCormick Place Field Hospital has now been closed, the state says some of the medical team was redeployed to backup nursing homes.
You know, in a situation where you make an incredible investment in a facility, only to have it not be used at all, you have to question, was I basing this off of data that was incorrect? Did I make some kind of assumption that wasn't right? That's why, we need to have a full and public hearing.
Besides alternate care, the state paid for alternate housing, a total of $3.5 million to rent out 6 Illinois hotels for first responders, healthcare workers, and COVID-19 patients who required isolation. While it may have been well intended, the service was seldom used downstate.
Whenever you do contingency planning, you prepare for the worst based on the information that you had.
In Springfield, a total of more than 400 rooms were rented out at these 2 hotels, but not a single person stayed there in April or May, and it cost taxpayers more than $1.3 million.
We would have simply been negligent if we did not have a plan to be able to take those folks, get them off the streets, give them a place that they could isolate, quarantine, ensure that they were the COVID positives, they got over that, and then they had the ability to walk out of that facility clean of the virus.
In one of the most unusual expenses, there's the bread spent on bread. Sliced bread, in fact, for Illinois prisons, at a total cost of $284,310. A spokesperson for the Department of Corrections says there's a good reason for it. Prisons had to buy loaves from an outside vendor because an in-house bakery operation was suspended due to the virus.
We've done the best we could.
The person writing the checks is Comptroller Susana Mendoza. She says Illinois and other states were victims of price gouging. They've also been on the lookout for potential scammers.
Every day, people are attempting to scam not just our state, but every state that is purchasing in the PPE arena. So it's important to have those relationships with the FBI and with the state police, which are actually part of our vetting process.
Illinois now has a $7 billion hole in its budget. The state's busted bank accounts are nothing new, but COVID made it worse. The governor and comptroller are hoping the Trump administration and Republicans will loosen restrictions on how the state can use $3.5 billion in CARES Act money it's eligible to receive.
The biggest chunk for us isn't in PPE purchase needs. It's actually in lost revenue to the state of Illinois, and that's where the feds could help different states, all the states really, in tweaking how they can use their CARES dollars.
We can't talk about the dollars spent without circling back to those 800 iPhones purchased for use at the hospital at McCormick Place. A lot of you have continued to ask about them since our report in April, so we checked. A state spokesperson says only 26 are currently in use. The remainder are in storage, and one was reported stolen. Ben Bradley, WGN Investigates.